So, guys, let's start with the uterine fibroids today. What are fibroids? Fibroids are abnormal growth that develop in or on the uterus. Means these are the growth that could be in the or on the wall or outside the uterus. What are the types of the fibroids? Intramural, subserosal, pedunculated fibroids, submucosal fibroids, and cervical fibroids. What is intramural fibroid? These are the most common type of fibroid and they grow within the myometrium. These fibroids are usually benign and could not need surgery despite of their big size. While they are the most common fibroids, and they usually appear on ultrasound like this. They can be on the fundus. Here is the fundus of the uterus. They can grow on the fundus, on the interior or on the posterior wall of the uterus. Patient most probably could be asymptomatic. Patient could not complain about any pain, any irregularity of periods, or any heavy bleeding. The next is subserosal fibroid. These fibroids grow outside the uterus or on the wall of the uterus like this. Like this. This is on the posterior wall of the uterus. Posterior means back. Interior means front side. Okay, here is the fundus, interior and posterior. You can report the location of the uterus according to their interior or posterior wall growth. Next is pedunculated fibroid. These are also the type of fibroid, but they grow and hang like a stalk at the wall of the uterus. They are benign, they are asymptomatic, they could not cause any heavy bleeding to the patient. Next is submucosal fibroids. These types of fibroids are rare and not common as the other and can cause heavy bleeding, pain to the patient. These grow within the myometrium and endometrium and can grow bigger. They need surgery and they push the endometrium, which causes heavy bleeding to the patient. Here are the images of the submucosal fibroids. So here is the fibroid near to the endometrium, between the endometrium and myometrium, and pushing the endometrium. It can push the endometrium interiorly if it is posteriorly. It can push the endometrium posteriorly if the submucosal fibroid is on interior wall of the uterus. Next is cervical fibroids. Cervical fibroids, as the name indicates, they lie in the cervix of the uterus. They can also report as the fibroid in the lower uterine segment. They are also rare and cannot cause heavy bleeding. These were the basic types of fibroids. In next video we will discuss how to report a fibroid according to its location and size and its type, whether it could be intramural, submucosal, pedunculated, subserosal or cervical fibroids, how to report them, how to write the report of ultrasound, and what to look into the fibroids. We will discuss all these things in the next video.